Hello, and thank you for joining us this afternoon for our live Q&A in conjunction with Colorectal Cancer Awareness Month. My name is Taylor Vessel with the UI Healthcare Marketing and Communications team, and I'm joined now by Athena Puski, one of our licensed genetic counselors. Now, today we're going to be talking about how your family history can influence your risk for colorectal cancer. Athena will be answering some of your questions as well, so feel free to ask those in the comment section now, or you can send us a private message. We're going to answer as many of those as we can. Now, one more thing before we start. This broadcast is just for informational purposes only. So if you are feeling sick or are concerned about your health, please contact your primary care provider. Thanks for joining us today, Athena.
Thanks for having me.
Yeah, so let's start with the basics. We know that colorectal cancer is the second most common cause of cancer death worldwide. Now, does colorectal cancer run in families? Is it hereditary?
So, colorectal cancer can sometimes be hereditary, but most often it is not. Approximately 70% or so of all colorectal cancer happens pretty randomly. It's really just part of the natural aging process of our bodies, unfortunately. In general, it's estimated that about 10% are hereditary, though, meaning that there is a mistake or mutation in one single gene that's being passed down through the generations of the family. And that one genetic mistake is making it much, much more likely to get colorectal cancer.
So, say someone is within that 10% category, how do they know if they are more at risk for colorectal cancer due to their family history?
Really, the only way we can determine if they're in that hereditary category and have a very high risk is through genetic testing. We do also know that family history itself is also a risk factor. So there are sometimes instances where we'll see several families with colorectal cancer. We don't find any genetic mistake or mutation through genetic testing, but there's clearly something there making it more likely to get colorectal cancer. Um, it's probably, we think, a very complex combination of several different factors in these scenarios: shared environment, lifestyle, and genes we don't know about, all working together, slightly increasing the risk for cancer. So, having something hereditary, a genetic mutation, does greatly increase the risk for certain types of cancers. But family history plays a role as well. Even if there's nothing genetic going on, just having that family history can be a slight risk factor.
We'll talk more about that genetic testing here in a second, but for those people who do have a history of colorectal cancer in their family, do the risks change based on maybe which relative had the disease?
It can in some cases. General rule of thumb is the closer the relative is to you, the more closely related they are to you, the more impact it has on your own risk to get colorectal cancer. So, for example, a cousin with colorectal cancer probably not having a huge impact on your own risk to get colon cancer yourself if there's nothing genetic going on. But a parent or a sibling, that is going to have more of an impact on your own chance to get colon cancer.
So, what recommendations do you have for someone who does have a family history of colorectal cancer?
My first recommendation is always first step, talk with your doctor. Let your doctor know about that family history, and then maybe talk about getting a referral for genetic counseling to talk through all of that. And then through genetic counseling or talking with your doctor, it might be decided that extra cancer screening is appropriate based on that family history. In some cases, most standard recommendations say that if you have a really close relative, a parent, sibling, or even a child with colorectal cancer, we want to do those colonoscopies every 5 years, starting at age 40, instead of the typical of every 10 years, starting around age 45 to 50. But once again, talk with your doctor because there are a lot of things that can impact those specifics, but that's kind of the general recommendation in most scenarios.
Sure. I want to, if you can repeat something for a second. So, does having, if someone has that family history, how does that change when someone should get screened for colorectal cancer? I want to make sure that we get that for the audience.
Yeah. So the standard recommendation by the National Comprehensive Cancer Network, their recommendation is that if you have a parent, sibling, or a child, a first degree relative, parent, child, sibling, you should get colonoscopies every 5 years, starting by age 40. If, though, one of those family members had colorectal cancer at a young age, we want to start those colonoscopies 10 years before their age at diagnosis, whichever comes first. So if your dad, just as an example, had colorectal cancer when he was 45, we'd want to start colonoscopies at 35 typically. Versus if dad had colorectal cancer when he was 70, we want to start them at 40.
Okay. Now let's go a little broad for a second. So, are all cancers that run in families hereditary?
Not all cancers are hereditary. So, like I briefly mentioned at the beginning, overall, most cancer not hereditary, not due to genetics, just happens randomly. And then some types of cancers just are not very likely to be related to genetics as well.
Sure.
So, certain types of cancers, such as lung cancer and cervical cancer, those are very rarely hereditary, almost always random, environmental, things like that. For most cancers, about 10% of them are thought to be hereditary, meaning they're due to a single genetic mutation in the family. But then there are some other types of cancers where they're much more likely to be hereditary than that 10%. Ovarian cancer is one of those examples.
For sure. As a genetic counselor, what are the benefits of genetic testing and for colorectal cancer specifically? And also, when would you recommend it to patients?
Yeah, so one of the big benefits of considering genetic testing is that it can give us a more tailored view of your own risk to get colorectal cancer and maybe even other types of cancers. And by knowing where that risk stands for you and what types of cancers you maybe have a high chance of getting, we can then tailor how we're screening you for cancer. And that can be things like maybe we're doing cancer screening starting younger than we typically would, or doing it more often, with the goal of that being that if you did get cancer, we would hopefully catch it at a very early stage. Because the earlier we catch cancer, the more easily we can treat it. Early detection really is key.
Absolutely.
In some scenarios, surgeries can be done to prevent cancer altogether, or medications can be used to lower cancer risk as well.
All right. Well, if you're just joining us right now, we're here with licensed genetic counselor Athena Pusky discussing how your family history can influence your risk for colorectal cancer. Now, let's go and take a couple questions that were submitted by our viewers. So, first one is John asks, does family history of colorectal cancer ever skip generations?
Yeah, I get this question a lot.
Okay.
So if there's a known genetic mutation in the family causing that colorectal cancer, that genetic mutation itself cannot skip generations. So if someone, if there's a family history of a known genetic mutation, but you do not have that mutation, your kids would not be at risk to have it. It can sometimes appear to skip generations because having a genetic mutation does not guarantee you will for sure get cancer. So there might be someone that lives their entire life without getting cancer, even though they still have that genetic mutation. But if through genetic testing we find out, okay, you do not have the genetic mutation that your parent has, then your kids are not at risk for it.
What if it's a reverse situation? What if a child gets colorectal cancer and then a parent is suddenly concerned? What would you say to those
Yeah.
folks?
So if a child has colorectal cancer, it's something that we would consider genetic testing. Usually we prefer to test the person who's actually had cancer to determine, is this even hereditary or is it other factors? And then if it is found out to be hereditary, that means that that child inherited that genetic mutation from one of their parents. So we would want to test both parents in that scenario to see which parent carries that mutation.
For sure. All right. So we've got another question from the audience here. So Kathy is asking about Lynch syndrome. Could you explain what that is for us and if there are any other syndromes that maybe are similar?
Yeah, so Lynch syndrome is the most common cause of hereditary colon cancer. It's estimated that about 3% of all colon cancers are due to Lynch syndrome. So, this is the most common cause, and one of the main things we think about when we see colon cancer running in a family. And Lynch syndrome can cause a high risk for not only colorectal cancer, but other cancers as well. That can be uterine cancer or ovarian cancer in women. We can also see other gastrointestinal cancer sometimes in families with Lynch syndrome. So we can sometimes see like stomach cancer, small bowel, pancreatic cancer, things like that running through the family. So this is what we usually have at the top of our radar when we're assessing a family for something genetic potentially due to the colon cancer in their family. But there are many other genes and conditions as well that can increase the risk for colorectal cancer. They're just not as common.
Sure. Now, Athena, we've talked about it a little bit, but can you explain the difference between genetic counseling and genetic testing?
Yeah, so genetic counseling is kind of the process of getting ready for genetic testing in a way. Through genetic counseling, what we do is we first gather information. We get information about your own medical history and the family history so that we can make sure we're choosing the most appropriate genetic test for you. And then a big role of genetic counseling is to provide education to make sure you understand what this genetic testing is, what it can tell you, and what it cannot tell you because it is not perfect, and what the results may mean for you to make sure you really are going into this with your eyes wide open and know what we can and cannot find out. And then we also, through genetic counseling, help you process that information. Are you ready to learn about a high risk for cancer? How do you go about telling your family about this information? Things like that.
Yeah. So,
Genetic testing is the actual test itself, usually done off of a blood or a saliva sample.
okay, that's what I was going to kind of ask Ness is what can people expect during testing or for cancer, the genetic testing? You said it's either a blood
Yeah.
sample or a saliva sample. Is there anything else they should be
Most
prepared for?
often, it's a blood sample or a saliva sample. In very, very rare instances, very rare, we need a skin sample. But
Okay.
most often, blood or saliva. And then, really, the process of actually doing the testing is filling out a consent form, getting a couple signatures, and then getting that blood sample or saliva sample.
Now, you mentioned sometimes there's a skin sample. Does the testing vary depending on the type of cancer? Like, is that for a specific type?
Yeah, so if someone has a blood cancer, leukemia, then we cannot use a blood sample or a saliva sample for that genetic testing. We have to use skin because essentially if we did a blood sample for them instead of getting genetic results for the genes they were born with, we're actually looking at the genetics of their leukemia, of the cancer. So it's not giving us the right information.
Okay. Now, if someone is interested in doing genetic counseling or testing, what is the most important piece of information that they'll need to have about their family history when they first start those sessions?
Yeah. So, really, before genetic counseling, one of the best things to do is just talk with your family and get as much information as you can. Find out who has had cancer, what type of cancer was it. If you can figure out how old they were, that can be very helpful. And then, if you are able to get details about what kind of treatment they had or anything like that, that can be helpful as well. Not all of those details are necessary, but it can be helpful because really the type of things that I'm looking for that might indicate a possible hereditary cause for cancer are
Hmm.
if we're seeing young cancers like colorectal cancer before age 50, if we're seeing certain combinations of cancers, such as colon and uterine cancer, such as for Lynch syndrome, and then if we're seeing those cancers across multiple generations, that's when we start thinking maybe there's a hereditary cause.
Sure. Well, if you're just joining us, again, we're here with licensed genetic counselor Athena Puski discussing how your family history can influence your risk for colorectal cancer. I've got one more question from the audience right now. And if you have any questions, please comment them in the comment section and we'll answer as many as we can this afternoon. So, Amanda is asking, should I be concerned if my mom and aunt both have a history of a lot of polyps but no colon cancer?
Great question. Colon polyps is also one of the things we really look at through genetic counseling and assessing the chance of having something hereditary. Now, it is not uncommon for someone to have a few colon polyps in their lifetime, two, three colon polyps. That's not overly concerning from a genetic standpoint. But if there's a family history or even a personal history of 15, 20, or more colon polyps, that is something that we often want to look into from a genetic standpoint.
Okay. We have another question from the audience here. Sam is asking, what does it mean if results come back negative? How do I know what caused my cancer then?
Yeah, so the terminology used can be a bit confusing. So a negative test result actually means that there was nothing genetic found. We did not find a hereditary cause for your cancer. Now, as far as figuring out what caused your cancer, we don't always know, unfortunately. If we do find something genetic there, it can give us a huge clue and say this is likely what caused it. But if there's nothing genetic found, in most scenarios, we cannot figure out what caused that cancer. And truly, most cancer occurs completely randomly with no specific cause to it.
Another question here, and it's kind of on the same topic. So it seems like people are getting diagnosed with colon cancer when they're younger. This is coming from Tammy. She's asking, is that trend of younger people getting diagnosed with colon cancer because of a genetic mutation?
Yeah, so in some scenarios, it may be. When we see a young colon cancer, that is something that makes me a little suspicious there might be something genetic going on. Recent data, though, is starting to show that we're seeing colon cancer at younger ages than we previously did, even when there's nothing genetic going on. It's not completely clear why this is. It may
Okay,
be environmental factors that we're starting to see this trend of younger colon cancers. And that's why recent guidelines have updated to say we should maybe start colonoscopies for everyone at 45 instead of 50. So, yes, we are seeing more colon cancers at young ages. It's definitely something we want to look into every time if there's something genetic going on there. But there is also just this trend we're seeing in research, and we're not 100% sure why that is.
for sure. It's kind of my own question. If someone is concerned about this, and you said talk to your doctor first, what's some information that they should bring to their doctor if they say, "Hey, I'm kind of concerned. What should I do?"
Yeah. So, first thing is have kind of a list of, okay, these are my family members who had cancer. This is how old they were. And then talk with your doctor and say, could this be genetic? Should I talk with a genetic counselor about this information? And then through genetic counseling, we kind of assess all of that to figure out how does this family history itself impact things for you. And even if we don't find anything genetic there, we may still tailor how we're screening you for cancer because the family history, like I said at the beginning, it can still be a risk factor for getting colorectal cancer, even if there's nothing genetic going on. So, talk with your doctor about that family history, ask if genetic counseling is reasonable, and then also ask your doctor and or genetic counselor, should I be doing any additional cancer screening?
For sure. Now, with that in mind, can you talk about some of the differences between seeing one of our licensed genetic counselors versus a direct to consumer test that you can complete at home and send back?
Yeah, so direct to consumer tests, I kind of think of as more of something that is can be fun to do. It is not a medical test though. It does not tell you as detailed of information as the testing done with a genetic counselor or a medical grade test. These at-home tests, they are not always as accurate. We can't trust the results as much for the health information. They also are not as detailed and don't look at as many things when it comes to certain health conditions. So if there is something specific you're worried about, like I'm worried about my family history of colon cancer, then an at home test is probably not going to give you all of the information you need. It is more of a fun test to do, and you should talk with your doctor and genetic counselor.
Got another question here. It says, my doctor didn't talk to me about genetic testing and I had colon cancer. Should I talk to her about getting tested? So I think they're asking if they can somehow connect with you about getting tested.
Yeah, so there are a lot of reasons why a doctor may or may not suggest get genetic counseling. And in some cases, maybe it's just not necessarily standard or appropriate fully for that individual.
Okay.
For example, if you're the only person in your family with cancer and you were diagnosed after age 50, we have a really low suspicion of something genetic going on. So that may be a reason. But I will say, I always suggest just ask your doctor. It never hurts to ask them, should I consider genetic counseling or genetic testing? And then maybe that can be considered. Even if you don't meet those criteria where we're suspicious of something genetic going on, genetic counseling, we can still go through that family history and talk about how does your diagnosis impact your family members' risk for cancer? What kind of cancer screening should they be doing? And is there anything else we need to be thinking about for you moving forward for cancer screening?
Another question here. What happens after you get the results from genetic testing? Do you go straight into that counseling, or what are the options?
So it can vary a little bit depending on if you saw a genetic counselor for genetic testing or if your doctor ordered genetic testing themselves. But essentially, once we have results back, and it usually takes about a month or so to get those results, then we look at those results and we compare it to the family history and we say, okay, does this explain the family history? Do we have an explanation there? And what do we do with this information? Based on the genetic test results, do we need to be doing any increased cancer screening for you? Do we need to be testing your family members for that genetic mutation? Or did we not find anything genetic, but we still need to be thinking about that family history and how that's impacting your own cancer risk? It can vary widely how we use all of that information depending on the exact genetic test result, what we're seeing in the family history, but it may result in doing cancer screening more often, starting at younger ages, sometimes risk reducing surgeries or medications.
Now, if someone doesn't have a family history of cancer, but they may be concerned about their cancer risk, or they want to get some more information about it, would you recommend genetic testing to those folks?
So I think it's definitely something that can be discussed with your doctor. At this point in time, it's not standard to do this type of testing if there's no family history of cancer, primarily because that means there's a very, very low chance you have a genetic mutation increasing your risk for cancer. These genetic causes for cancer are not common.
Okay.
But we are surprised sometimes, and it's never a completely zero chance there's something genetic going on. So if it's something you're really concerned about or just interested in, talk with your doctor. And then I would say also talk with a genetic counselor during this time as well, because my main role in these scenarios is I want to make sure you understand all of the potential risks that can come with genetic testing. It is a very helpful tool in many scenarios, but it's not perfect. It can come along with uncertainty. It can cause anxiety and various things. So we want you to go into this eyes wide open. If you fully understand the potential risks, but the benefits outweigh those risks for you individually, then I think genetic testing is something that we can definitely consider for you.
For sure. Well, thank you so much, Athena, for joining us today and sharing your time and expertise. Are there any specific takeaways that you would want to end on for the audience, things they should know going away from this broadcast?
I think really the biggest thing is being aware of your own family history. It is so common that I hear that sometimes families just don't want to talk about health information, which I get, but it is so important for the future generation's health. So gather your family history, maybe keep a running document among your family members of what are the main health conditions going on in the family and keep note of what are the diagnoses, how old were they, and gather that information because that is a really big tool in helping to manage your own health.
Absolutely. Knowledge is power, right?
Exactly.
All right. And thank you in the audience for watching our broadcast today. Now, if you tuned in after we started, this full broadcast will be available soon at this same link. So stay tuned to our social media channels for more valuable information during Colorectal Cancer Awareness Month. Finally, please take care of your physical and mental health. Thanks for watching. Have a great day.